Hi, everyone. Before I start today's episode, I want to take out time to appreciate everyone who has been a partaker, who has been listening to this podcast from day one. This episode is of great significance. We have crossed the 30th milestone. This is our 30th episode. And I want to appreciate everyone who has been listening from the first episode even till now. Thank you so much. A lot of people have sent me messages via email, via social media, encouraging us, and I want to appreciate all of you. Someone has been following from Romania. I want to appreciate you. From faraway Netherlands, Poland, also Russia, across the globe. I would like to connect with you. I would desire to, I would appreciate if you can reach out from Romania and Netherlands, Poland. Those are far away places, yet you took out time to follow us on Design for Recovery. I want to so much appreciate you. It has been a great privilege to serve our audience via this podcast. I want to say a big thank you to everyone. And for those who would like to join us on here, it has been a great journey. We'd like to have you on board on Design for Recovery. I am Lowo Adeyemi, the number one healthcare architect, fervent advocate for environment that heals, and this is Designed for Recovery, a global platform where design intertwines with dignity, transforming the built environment into a vital ally in healing process. In today's episode, we delve into a pressing intersection: climate and care. How can we conceive healthcare facilities that nurtures both human well-being and planetary health? Today's episode is titled Designing for Climate Responsive Recovery. In a world beset by escalating floods, heat waves, disasters, healthcare architecture can no longer adapt a stance of neutrality. It must embody resilience through intentional design. And until we see climate crisis as a health crisis, we may not take necessary and probable steps. Climate change is not a remote environmental challenge. It represents an immediate health crisis. Flood devastates medical facilities. Heat wave inundate hospital with patients. Wildfire deteriorates air quality and burden respiratory wards. According to the World Health Organization, climate change is projected to precipitate in an additional 250,000 facilities annually between 2030 and 2050, predominantly due to heat stress, malnutrition, and vector-borne diseases. Moreover, when calamity strikes, hospital frequently becomes the initial casualty, rendered powerless, submerged, or isolated. Thus, resilience in healthcare design is not a luxury, it is an essential lifeline. A hospital cannot administer healing if it's submerged. A clinic cannot function if the power grid collapses. And a community cannot recuperate if its healthcare infrastructure falters first. This is where climate responsive design emerges, not merely to endure crisis, but to adapt, adjust, and recover while steadfastly serving those in their need of care. Let's give consideration to elements: flood, heat, and disaster. In a flood-prone regions, from coastal metropolis to riverine settlements, the discourse commences with elevation and redundancy. Elevated plinths and raised foundations safeguard critical areas such as emergency departments and electrical systems. Floodable landscape and bioswales effectively manage stormwater in a natural manner. Amphibious structures, edifices that float when inundated, represent pioneering innovation in regions like Southeast Asia. However, resilience also encompasses the continuity of care. backup generators, decentralized energy microgrids, and modular medical ports ensure operational continuity even when conventional infrastructure falters. Let's discuss how we can adopt our heat resilience design. As global temperature ascends, the incidence of heat-related illnesses is surging, and hospitals paradoxically can transform into heat traps. Passive strategies are imperative in this context. Let's mention very few. One of them is the orientation of the facility and shading. A north-south building orientation coupled with deep overhang and operable shading device mitigates solar gain. Natural ventilation and cross breezes is another factor we can consider. In locales such as India and Nigeria, where cooling energy is both costly and unreliable, passive design transcends sustainability. It embodies equity. It guarantees comfort without reliance on precarious energy grids. And that takes us to the third design strategy, design reliance system. In addition to flood and heat, healthcare design must proactively anticipate systemic shock. Decentralized energy and water system, creation of solar microgrids, rainwater harvesting, and grey water recycling ensures that facilities remain operational even when municipal system collapses. The use of adaptive design allows for the swift conversion of spaces. Outpatient wing can sometimes metamorphose into a tri-unit, and parking lots can transform into emergency shelter. Material resilience is also very important. From reinforced concrete to impact-resistant glazing, this guarantees safety under extreme conditions. We must know that a resilient hospital is not merely the one that will stand disaster, it is the one that continues to foster healing. Now in this segment, I would like us to consider how passive design can activate healing. What is exquisite about climate-responsive design is that it frequently augments the healing process. Passive systems, air, light, and water are not merely environmental strategies. They are also psychological and physiological interventions. For example, daylight harvesting diminishes energy consumption while regulating the circadian rhythm. Natural ventilation mitigates infection risk while fostering a connection between patients and the outdoor environment. The use of green roofs and courtyards also offer therapeutic landscapes, soothing both patients and all the healthcare givers. Thus, when we engage in discussion about sustainable design, we are in essence addressing the integrative recovery. We need to come to understand that the process of healing from illness and recovery from climate trauma exist along the same continuum. Both are contingent upon stability, comfort, and a profound connection to nature. On this segment, let's consider a few real-life case studies. The first of them is the Butaro Hospital at Rwanda that was constructed with natural ventilation and local volcanic stone. This hospital remained cool without the aid of air conditioning, even in sweltering climates. The second and the last case study is the Balmio Sanatorium at Finland. This place is historic yet a timeless reference. It is one of Alvarato's design that harness light, air, and vista as integral components of healing experience, establishing a paradigm for climate-conscious humanist architecture. These instances illustrates that resilience transcends mere survival. It embodies the design of dignity amid adversity. Let's look into the aspect of decentralization. How decentralization can also be of help. In numerous regions, particularly within the global south, central grids are susceptible to disruption. A single power outage can jeopardize hospital capacity to deliver care. Decentralized, self-sufficient cluster equipped with local solar energy, battery storage, on-site water treatment, and modular cleaning around a future of resilient healthcare infrastructure. This kind of model not only withstand climatic shocks, it also enables equitable access to remote, underserved population. When design decentralizes, health democratizes. We most of the time discuss sustainability as minimizing harm. However, the next frontier is regeneration, design that actively rejuvenates ecological and social systems. Let's together envision hospitals that sequester carbon through bio-based materials, cleaning and purifying rainwater for the benefit of surrounding communities. Landscape that does not only restore soil and biodiversity, but also promote healing for individuals. This represents climate responsive design at its pinnacle, not merely enduring the climate crisis, but also contributing to its reversal. As the climate evolves, so too must our healthcare facilities. For resilience encompasses more than just infrastructure, it embodies trust. The assurance that when calamity strikes, our care environment will remain steadfast. Climate responsive design transcends sustainability. It embodies survival, equity, and empathy manifested in built form. Thank you for joining me on this 30th episode. Once again, I want to say a big thank you to all who have been listening from episode 1 till date. Thank you very much. And until next time, let us continue to envision a future where healing and resilience are inextricably intertwined. I remain your host, Lowo Adeyemi. Goodbye.